palsy is a relatively common condition actually. The incidence is about 4 in 1,000 live births. And if you consider UAE, where in a year we have about 80,000 births, you can expect about 360 children with cerebral palsy being born every year. And clearly this has a lot of impact on the healthcare system of any country, and also an impact on individual families.
75 to 80% of the causes of cerebral palsy are due to prenatal problems. Following a healthy lifestyle for a pregnant woman, taking folic acid prior to planned pregnancy, as well as following a healthy lifestyle during pregnancy, complete avoidance of alcohol, complete avoidance of smoking. Make sure she has a good and balanced diet. She needs to make sure that she follow up with her OBGYN physician, and also to stay in touch with her OBGYN physician and regarding her infant. Now, I don't think chromosomal abnormality will be able to prevent it, but it is very important for family, if there is any chromosomal abnormality, to try to find what kind of chromosomal abnormality for planned future pregnancy. Now also, after we have a patient with cerebral palsy, we would try to prevent the complication of spasticity. So physical therapy is extremely important for these kids, and the earlier we start, the better we are. Offering them a treatment with botulinum toxin to treat the focal spasticity, or when the spasticity includes more than 4 muscles, is extremely helpful, as well as trying to give them oral medication to help decrease the spasticity, along with the motor physical therapy for spasticity that would be optimal.
Currently, there's no cure for cerebral palsy, but a variety of resources and therapies can provide help and improve the quality of life for kids with CP. A variety of medical specialists might be needed to treat different medical conditions.
Sometimes doctors order investigations to clarify the diagnosis further. One of the most common form of investigation that is ordered is called MRI scan. And this is basically looking at the brain and making an image of it. MRI scan it's basically a magnetic field studied by a computer using radio waves as well, and it forms an anatomical picture of the brain and helps us to identify where the injury lies and to what extent the injury is, so that some help with prognosis is done, and we can explain to parents what can be expected of their child. If a child has seizures or number of seizures causing epilepsy, then the doctor might order what is called as an EEG, or electroencephalogram. It's basically a test by which certain stickers or leads are put onto the scalp, on the head, on different parts, and the brain activity or electrical activity is studied. Any abnormality in the brain or electrical activity can be picked up, and if the child's seizures are because of epilepsy, treatment can be initiated. Sometimes the doctors request blood tests, and this is not mainly to make a diagnosis of cerebral palsy, but usually to rule out other causes that might mimic cerebral palsy. And these tests could be genetic, metabolic, or some routine tests.
Now, a special vaccine like influenza A, it would be very helpful for these kids to prevent them from having, the consequences of having influenza. Also, regular immunization should be given to all these patients, as immunization would not cause cerebral palsy, and there's no proved link of immunization to cause brain injury. But at the same time, it will greatly reduce the sequelae of having infection, especially in kids with cerebral palsy. Again, we need to emphasize these kids need to be seen and evaluated by a multidisciplinary team, preferably including a child neurologist who is trained to see these patients, a physical medical rehab patient also if is available, physical therapy team, a nutritional team, as well as to provide them with the required and needed equipment in case they are not able to ambulate or to move. Social as well as psychological support to the family is of paramount importance, and I think this should be taken into consideration, and the psychological as well as the financial status of the family should be periodically assessed. For any further information, family can refer to the resources available for kids with cerebral palsy, like the American Association of Cerebral Palsy, or to the nearby physician with a special expertise in treating kids with cerebral palsy.
Physical therapy, occupational therapy, speech and language therapy, along with adaptive equipment, are popular forms of treatment for children with cerebral palsy.
Physiotherapists are one of the cornerstones or one of the most important professionals that are involved in the care of a child with cerebral palsy. The referral to physiotherapist needs to be made as soon as the diagnosis is made or within the first year of life. And the work they do on the child, like strength training and resistive exercises, helps improve the mobility, prevent contractures, which is permanent stiffening of the muscles, and it also helps to improve the child's gait and function. What they do is they have regular sessions with the child on a weekly basis, and they produce reports or outcome measures every 2 or 3 months to see the improvement. And with the help or with the assistance of medication to loosen the muscles, and sometimes something called as Botox or botulinum toxin to reduce the muscle stiffness, the physiotherapists carry on maintaining the stretch in a child and helping their mobility with time. The other therapists that are involved are called speech and language therapists, and they mainly help with improving a child's speech. And they also concentrate on helping a child improve their feeding behavior, because many of the children with cerebral palsy have difficulties with swallowing, and their swallowing is not coordinated, and this can lead to what we call as aspiration, or the food going into the windpipe instead of going into the food pipe. And to help them improve this coordination, speech and language therapists assess them initially and then provide them slow graduated food plan and training to improve their swallowing. The other therapists or individuals like orthotists who are involved, who measure the children and make specific devices for improving their mobility and sometimes to improve their hand function as well. Occupational therapists are basically professionals that help a child to carry on day-to-day activity. They help with improving fine motor skills like writing, dressing themselves, changing their clothes, taking off their clothes, going to the school and coming back, and basically helping them with a daily routine activity at home and at school.
Now coming to the therapies, we can understand therapies in 3 ways. The first and the best way is involving the parents, the family and the caretakers at a primary level. Tell them how to make the baby have balance. Just tell the baby to stand on his or her own. Once she develops that standing balance, give her an aid, a chair or a cerebral palsy chair or something support, so that she clings onto it and then starts balancing, standing, feeling happy about it, and starts to ambulate, walk slowly. See, this is a very little and subtle happiness that gives them the driving force to do it. If you keep on protecting the child, they will develop fear and they will love to cling onto our shoulder. They will never develop the urge to walk and to ambulate, which will become a curse for us later as a parent.
Management of cerebral palsy includes physical therapy with the help of the team that includes physiotherapists and neurologists and occupational therapists. But other than that, one of the major cornerstones of treatment is the other therapists that are involved, like speech and language therapists. Usually children with cerebral palsy have delayed speech, either because of a central cause, that is with the processing of the brain, or because of the muscles that are involved with articulation. And speech and language therapists work with these children on a regular basis to improve their outcome and to bring about a form of language. Sometimes if the language is not there because of the severity of the damage to the brain, assistive devices are used, like voice-activated synthesizers. Sometimes different boards are used where they can point towards symbols and communicate with their peers or parents.
The management of patients with cerebral palsy must be individualized based on the child's clinical presentation and requires a multidisciplinary approach.
There's a misconception among people sometimes that cerebral palsy is associated with only birth, but about 10% of children who have cerebral palsy have incurred the damage after their birth. So either they have come up with a severe infection like meningitis or encephalitis, or they're met with a very severe form of head trauma like road traffic accidents or fall from a building, anything that leads to damage to the brain or reduced oxygen supply to the brain. Now, it has to happen during the period of developing brain, which is usually in the first 2 years of life, and if the injury happens during that time, it will present as a specific type of cerebral palsy depending upon the area of the brain that is involved.
Medicines can help control some of the symptoms of CP, prevent or minimize complications, and treat other medical conditions related to CP.
Sometimes your doctor might prescribe you certain medications for your child, and the most common medications that are prescribed are for helping with seizures. The medications are called anti-epileptic drugs, and they come in different forms. Sometimes medications are given to control spasms or stiffness of muscles. You might hear words such as baclofen or diazepam or tizanidine. These are medications used to control the stiffness and also to reduce the pain in the child, because the stiff muscles can sometimes lead to increased pain in children. Other than this, surgeons are involved sometimes to correct anatomical deformities such as curvature of the spine or scoliosis. Sometimes they help in improving the gait of the child by lengthening certain tendons or muscles in the legs, and you see a dramatic effect of this. And there are also orthotists that come into the picture who create or produce individual or specifically measured devices to help with the child's mobility, and specific wheelchairs to help with the child's mobility.
Muscle relaxants are the most common medicines used for people who have CP.
Coming to the role of medications in daily use. In daily use, what are the medications that can help a cerebral palsy patient? Tablets like baclofen, smooth muscle relaxant. Tablets like benzodiazepams like diazepam. Why? To reduce fits, because as we said, if the patient is having regular fits, the brain development goes back, not forward. So there are certain medications, anticholinergic drugs. Why? If the patient is drooping a lot, saliva, it's very unhygienic. So you need some medicines which will control all these kinds of symptoms. So that is the role of medical treatment.
In babies who have risk factors of developing cerebral palsy, they are monitored very closely by their neurologist or by the pediatricians on a regular basis, and doctors look for specific aspects in the examination. They do a thorough assessment of the development. They look at their motor ability, their posture, their coordination, the integrity of their vision and hearing, and they also look at the development of their speech and intelligence with time. The scrutiny is done such that any early sign is picked up and all the strategies are laid out early. What I also have to mention is that, as I said earlier, cerebral palsy is not a progressive condition, it's a static condition. However, it can evolve with time. But one has to be very clear as a physician when you see a patient with cerebral palsy, if they are losing skills. For any reason, if a child is losing any form of skills, then it is probably not cerebral palsy, and other neurometabolic, neurodegenerative conditions and conditions like epilepsy need to be looked out for, because these conditions can be treated early and the child's neurodevelopment can be improved. And sometimes investigative tests are used to clarify these things, whether differentiating cerebral palsy from mimics of cerebral palsy. And the most common of these is an imaging modality like MRI scan, EEGs and blood test even.
Now coming to a diet sheet which people advise for autism, ADH, other kinds of problems. There is no separate diet sheet for just the namesake for cerebral palsy children. Anything that will improve the brain function is applicable to all these people, all these children. High protein diet, whatever is neurostimulation, whatever diet which improves the neuromuscular coordination, neuronal transmission is good enough in cerebral palsy.
Kids with CP need good nutrition and healthy foods just like other kids do. But sometimes, they might need more or fewer calories depending on their activity level and muscle tone.
Cerebral palsy cannot be cured, and we have to appreciate that and understand that. But that doesn't mean it cannot be treated. And there's a difference between curing a condition or treating a condition. When we say cerebral palsy can be treated, you need different professionals to help a child with this. And this is mainly done to improve the child's capability and quality of life. And earlier the treatment begins, the better the outcome would be. And basically to improve the developmental abilities of the child and to learn new skills to help them achieve the tasks that they find challenging. And it's a whole team of people that work with the child. The cornerstone of management of cerebral palsy or treatment of cerebral palsy is management of posture and movement. And usually the team involves a neurologist, a physiotherapist, an orthopedic surgeon, orthotists, and people that work with the child in the nursery or at school. And what tends to happen is the different types of movement disorder or the extent of spasticity is studied very well. So whether the child has dystonia, which is abnormal involuntary movements, or the child has ataxia, which is incoordination, or if the child has athetosis, which is slow writhing movements of the arms, or if the child has only spasticity. Each of these different movement disorders are studied, and the specific individual is assessed by each of these professionals. And a treatment strategy is laid out, and each of these professionals communicate with each other for the betterment of the child's movement and mobility.
Surgery for people who have CP may help reduce muscle stiffness or spasms and allow more flexibility and control of the affected limbs and joints.
Most common form of orthopedic surgery that is carried out in children is tendon lengthening procedure. You would have seen children with cerebral palsy have very stiff ankles by which they walk on their toes. And that is because of the stiffness of the muscle behind the leg. And if with the use of medication and stretching exercises we are not able to improve the posture of the foot, the orthopedic surgeons are involved and they help to lengthen the tendon and therefore straightening the foot as much as possible. And I have seen children actually starting to walk after such procedures, and they are one of the most commonly carried out procedures in children with cerebral palsy. There are other forms of surgery sometimes. In older children, they go on to develop what is called a scoliosis or curvature of the spine. And many a times they won't require any surgery because it won't have an effect on their breathing. But sometimes it is so severe that they need a corrective surgery for for the spine basically. Sometimes surgeries are carried out for hip dislocations, sometimes when the hip comes out of the pelvis and it has to be put back in because it can cause complications in the future. Sometimes surgeries are carried out to help with contractures, where the arms or the joints are fixed in certain position because the muscles have contracted without much input from the physiotherapist or medication.
Now coming to the success stories, stories that give hope. I would like to say, in my own life's experience, I have seen children who was operated by me. They have grown into full adults, they have become MBAs, they have become officers, some are running schools, some have got government job, some are independent business entrepreneurs. Now let's go into disability as a general thing. Never discourage a disabled child, dear parents. If Stephen Hawking was discouraged, today he wouldn't have become an astrophysicist. If Helen Keller did not contribute, Helen Keller would not have invented Braille, the language for the blind or the visually challenged. So likewise, I have got so many examples of disabled children growing into very efficient adults just because they were made to believe that they can. And once we believe we can make a very big difference. And that's where early intervention comes.